As COVID-19 infections increase in the country, there's an urgent need for more people to be tested. Earlier this week, Health Minister Dr Zweli Mkhize said 67 mobile units will be used for COVID-19 sampling and testing. The National Health Laboratory Services has 7 units and now 60 more have been procured. It's not just people in cities and towns who need to be tested, but residents in rural areas where access to even primary health care is limited. Currently, there are 6 laboratories performing COVID-19 related tests at the NHLS and various hospitals. Dr. Kammy Chetty, who is the Chief Executive Officer of the National Health Laboratory Services, joins us on the line to talk a little bit more about this. Good to have you, Doctor. Thank you so much for joining us.
Good morning, Leanne, to the listeners.
I suppose the question we need to ask you is how long will it take to get the full 67 units up and running, and where exactly will they be located?
Thanks very much, Leanne. So we have, as you've mentioned, we have procured 60 vehicles, and during the month of April, we will be rolling out over the next 2 weeks, really. We'll be distributing those vehicles through to the various provinces. So we've allocated 1 vehicle per district and 1 per metro, and then we've given additional vehicles, especially to the provinces where the need exists. So the vehicles have been equipped. We have 2 types of vehicles. One's called a mobile testing laboratory, where it is equipped with equipment that can do testing. And we've got a vehicle that does both screening and sampling of patients, which acts as a depot. The samples get taken and stored in a fridge and then taken through to the laboratory. So right now we've got 7 vehicles on the ground. Today we're distributing 5. On Monday we're distributing another 5. And we've got a whole rollout plan. So on a daily basis, the vehicles over the next 2 weeks will be distributed to the various provinces.
So when we talk about these vehicles being up and running, what is the reason that they're not ready as yet? Are they still being set up, or perhaps you can talk to us and clarify that?
So the vehicles have been procured over a very short period of time. Normally it takes about 10 to 12 weeks for the vehicles to be procured and converted. So we've done quite a fantastic job in being able to get those vehicles. We've got all 60 vehicles, and at the moment what we're doing is branding it and equipping it with, as I said, it has a computer with a Wi-Fi that's attached to our lab information system. We've got a fridge, and in certain instances we would put the gene expert equipment on. So we've brought out companies that are attached to the company that we bought the vehicle from. They're working overnight. So it's and as the vehicles get equipped, we are moving it out. So it's actually been done extremely fast, considering the amount of time that we had to do this.
Yeah, I must.
And can I also just explain that with regard to the equipment that we've got in, the company Gene Expert has only recently, less than 2 weeks ago, come out with a new testing kit that's been approved by the FDA. So that's on the 20th of March. We have already put in plans to procure those test agents, and we're really pushing the company to get it in as fast as possible. We're hoping it will be in next week, so that we can validate it very quickly and then utilize the equipment over the equipment in the mobile laboratories. But I also need to point out that it's not just those machines that are going to be doing the testing, because we've got a number of state-of-the-art equipment in our virology laboratories throughout the country that will also be doing the testing. Yeah. And that's the high-volume testing that they would be doing.
Yeah, I mean, it's quite incredible to have a look at the technology involved in all of this, because, I mean, the results, we usually had to wait. It's amazing how it's been shortened over the time, because I know that at one point people were waiting days to get their results. Then it's gone down to 24 hours, and that's been quite efficient, I must say. And now it's claimed that these units will be able to give a definitive result within 45 minutes. This is quite incredible, actually. So talk to us about how that's going to work, and of course how this is going to get these results to come out a lot faster, because the more you test, the better picture you get for a country, no doubt.
No, absolutely. So the cornerstone of being able to stop this epidemic and flatten the curve is testing. The Minister and President and the DG of the WHO have all said it's testing, testing, testing. So that's why we're working together with the national department and provincial departments who are doing the screening. We're there to support them with our mobile vehicles. And you're quite right, it's amazing that how the technology has advanced. And as it's advancing, we're keeping an eye. So we're very excited about getting a mobile machine. It's a small machine that does 4 at a time, and it's automated right from the start. So you take a swab, you put it into the reagent, and then you put it into the machine, and you have the result 45 minutes later. So suppliers themselves are coming out with innovative technology. There is another company that we're also pursuing, which has just recently also come out with a similar machine that we'll be taking a look at. There's other companies, for example, Abbott has also come out with a machine, but a decision has been taken that machine only gets produced for the US. And unfortunately, I've approached the suppliers, I've asked them if it would be possible to get some in South Africa. So we're pursuing all avenues, and we know that the sooner you get the results, plus you make the services accessible to the community, we're going to be able to reach out to a lot more people and get them tested.
Yeah, I mean, if we look at so far how many people have been tested in South Africa, and please, the figures that I have may be wrong, so you can correct me. I'm glad that we're speaking to you. But as it stands so far, 47,000 South Africans have been tested for coronavirus. Is that the correct figure?
The figures get released, Leanne, by the minister on a daily basis.
Yeah.
And so the official figures will be released by him.
Okay. All right. I think that's the official figure. But I mean, if you look at 47,000 of a population of 55 odd million people, I mean, that obviously is just a drop in the ocean. And that's the whole idea, is to get a bigger picture. The minister has on 2 occasions now warned us, because we've seen very small increases in those figures over the last 2 days. I mean, just 82 new infections reported yesterday. So we're sitting at 1,462 positive cases of coronavirus in South Africa, keeping it under control. But he has warned, not saying that it definitely is, but he has warned that this may just be that calm before a massive storm hits South Africa. Is that still the position that we're taking right now, that it's still too early to tell how South Africa is going to handle this and react going forward?
The message that the minister has made is we mustn't become complacent. So even though some of the new positives is decreasing, what he's saying is that we need to become to scale up our whole program and get many, many more tested, because that's the way that we're going to stop the epidemic. And that's the intention of this program. And to make sure also, and you're quite right, I mean, it's around 47,000, but it's to get it to the people who haven't been able to get to testing sites. So we'll be in the communities, in the rural areas. We've identified where the hotspots are, and we'll just make sure that we get as many people tested as possible.
Yeah. A lot of skeptics out there, and a lot do believe, and medical experts adding their voice to this as well, that the virus in South Africa is much bigger than logged so far. Are you in agreement with this?
Well, that's what the whole community screening program has to determine. So the provincial departments of health together with the national departments, are going house to house with community health workers, with a questionnaire, and then if we pick up people who have got the symptoms and signs, they'll be referred then for sampling.
Yeah.
So we'll get a much, and then the ministers also asked us to investigate the issue of rapid tests, which are antibody tests. So that will also give us a sense of what the prevalence is. And there's a whole plan as to how that gets done.
Now, the big thing, of course, is it has been a worry since the outbreak of this, and that I think is the reason why South Africa, and South Africa genuinely has been praised for its reaction to this very fast reaction towards coronavirus. But the issue still remains townships, informal settlements, very overpopulated urban areas. They are of high concern, given that close proximity and the close person-to-person contact. These mobile testing units, I imagine these are the areas that will be targeted mostly for use.
Yes, Leanne. So each province, from national, there has been planning that's looked at the most vulnerable districts and wards, and that's been used as a planning tool to decide as to where to go. So with the vehicles that we've already deployed, for example, in the Free State, with the number of positives being found after contact during an event, we are also stepping up the number of vehicles we're going to send there. In Gauteng, which has got the highest number so far, we are targeting those areas.
Quite an important question for particularly medical personnel and those that are doing the testing. Do you have enough personal protective equipment or gear for the healthcare personnel that are out and about and working for the communities? And for how long do you foresee that you will have enough, and then suddenly we'll start seeing shortages in South Africa as we're seeing around the world?
So we have procured a number of PPE, but internationally there is a challenge. We're continuously working, phoning suppliers all the time, but the other countries are also in lockdown, and so we end up with the problem then of the factories not doing the production. But we've been working together as government. We work together with the Department of Trade and Industry, the Presidency, and where we have problems with planes not coming in, for example, there's efforts that get made to see how we can charter flights in order to bring in some of these, not only PPEs, but also the test kits as well.
Yeah.
So rest assured that every effort is being made, but we're facing a situation that many other countries are facing.
Yeah.
And we're quite fortunate in that South Africa does get prioritized. We are high up in the list of the suppliers.
That's encouraging to hear. It really is. But there's also, with this gear and all of the protective clothing and masks and everything that goes with this, there is still that great fear that we may spread this to urban areas if, in fact, the protective gear is not proper, and that we go in and we're doing testing, but at the same time, we may very well be spreading this virus to areas that may not have had it. Is this a concern on your side as well?
So, as the NHLS, will take every measure to make sure that all standards are adhered to. When the minister launched the mobile vehicles, you'd have seen that there is a protection in the form of how the samples get handled, because it's done within a confined environment where you put your hands into gloves and you make sure that gets protected. So plus we have the visors and everything else to protect both the staff and the public.
What happens if a person actually tests positive in a very remote, hard-to-get-to area? How long will it take for that patient to actually get assistance? And if they are tested positive, are they removed out of that community immediately for medical attention?
So the Department Department of Health is responsible for the contact tracing, but admission to the hospital and the form of quarantine is determined on a clinical need, but also you take into account that if a person can't self-isolate or get quarantined, then the clinician will make the decision whether to admit the patient into an isolation ward.
Yeah. Just a couple more questions before I let you go. I know I'm throwing a lot at you, but I suppose this is the information that's vital to all of us that are sitting and relying so much on you for the sterling work that you and your organisation are doing. Let's talk about these home testing, and a lot of concern was brought up about people suddenly now having to open their home to people that are going to come and test them in their houses. How is this, and who is actually going to be conducting these tests that are going to be in houses?
So the National Department of Health, together with the provincial departments of health, are responsible for the community screening, and they have mobilized thousands of community health workers. We're there to support the departments of health, with the sampling and the testing. And so the NECs for health, the HODs will be contacting communities, informing them that this is what's going to be done, and be visible. They would be properly identified, and they will go door to door to do the screening.
So, finally, Minister Mkhize said that the mobile units will substantially increase testing. We spoke about this at the beginning of the interview, those that are going out. From currently 5,000 tests in 24 hours in 10 laboratories countrywide to 80,000 tests in just 24 hours. Are you ready for this? Is the National Health Laboratory ready for such a surge in testing?
So, Leanna, I just missed the number that you gave, but let me just, if not, I'll so we currently from 5,000 tests, we're looking at gearing up to 30,000 tests per 24 hours. And we've done very careful calculations with the equipment that we have to just ensure that we've got the capacity. Also, so we've got the equipment. We've checked how many tests can be done. The limiting factor is the number of test kits that we get in, and we've gone all out to try to procure as many test kits as possible. The 30,000 tests are not going to be done in the mobile units only. The 30,000 tests will be together with our various laboratories. So we've got at the moment, we've got brand new machines in 10 of the facilities called BioRad. We've also got 18 Cobus 6800, 8800 machines, which are state-of-the-art, just also recently been released in the USA, and we've immediately procured the test kits. And then we've got the gene experts in 180 sites throughout the country, and we're procuring more of those to put into the mobile vehicles. So all in all, we've got a fantastic network of laboratories, and normally we service 80% of the population of South Africa with about 92 million tests. So we've got the network, we've got the expertise, we've got the skills, we've handled epidemics and outbreaks before. We've got a very dedicated team of people working in the NHLS who go beyond the call of duty in order to ensure that we'll be able to deliver.
Dr. Kammy Chetty, thank you so very, very much for talking to us, and please thank your team on behalf of South Africans for the work that they are doing to try and protect us and also getting those results to us as fast as they are and now in larger numbers. So thank you very, very much for being with us. Dr. Kammy Chetty is the CEO of the National Health Laboratory Services, talking to us about their readiness to deploy the mobile testing units for COVID-19 nationwide. And as you heard, those testing now will find their results coming in a lot faster, and also we're going way above what is currently the results coming out now over a 28-hour period. So thank you very, very much. That leads us to